Welcome to the Via Benefits Exchange, a podcast where we share the latest market trends, legislative updates, and exchange of ideas for employers, plan sponsors, and consultants looking to simplify healthcare benefit administration, reduce benefits-related costs and liabilities, and elevate spending account offerings to employees and retirees. Welcome to the Via Benefits Exchange. Today I am joined by Margaret Rutter, Meghan Scott, and Eric Stanger. Could you introduce yourselves? Margaret, let's start with you.
Hi, I am Margaret Rutter. I have been with WTW for 27 years and play a number of different roles. One of my areas of expertise is in helping organizations with change management and communication when making any type of retiree medical change, specifically a transition to the individual marketplace from a group health plan. Happy to be here today.
Happy to have you here. Thanks, Margaret. Meghan, can you introduce yourself?
Hi, I'm Meghan Scott. I am a senior retirement consultant and actuary with WTW and have been with the firm for over 20 years. I work mostly with colleges and universities, and so I lead our higher education industry group within WTW.
And Eric, can you introduce yourself?
Sure. Happy to be here. I have been working with organizations who are evaluating and implementing retiree health exchanges for about the last 15 years, and in particular had a focus in the last 7 or 8 years on higher ed. And so work through the complexities and the financial considerations in moving from group benefits to an exchange.
Great. Well, thank you all for being here today. Eric, let's start with you. Most of our listeners probably already know what an individual marketplace is. For our new listeners, can you start by giving us just a quick overview of what the individual market or retiree exchange is?
I'm happy to. And a lot of traditional employers provided their retirees with group health benefits. And that was before there was a thriving individual market for similar plans. And that market has been created by various legislation over the years. And for the last 20 years for Medicare participants and for the last 12 years for pre-Medicare participants, there has been a growing and increasingly stable competitive marketplace where people can go out and shop and find great choice and value and continue to have a subsidy from their former employer. And so it's been a way for employers to increase stability and sustainability of their group benefits without necessarily diminishing the value and the choice for their retirees.
Eric, maybe Meghan, why would a college or university consider an individual marketplace for its retirees?
Yeah, I think there's a couple of simple things that many higher education institutions are facing. The most obvious is dramatically rising healthcare costs for their retirees. They are doing their due diligence and looking at all different available options. An exchange is certainly one of them. I think the other is that supporting retirees can often be really administratively burdensome and complex and take a lot of people's time. And higher ed organizations are looking to streamline and modernize. Dare I say, we find many that are looking at solutions that can take some of that administrative effort off of their plates.
And I'll pipe in too. I think there's a trend in higher ed specifically around personalization and empowerment. So giving retirees the tools and support to make informed decisions about their own healthcare is particularly compelling.
And I'd say right now, with all the challenges that higher ed is facing, those organizations that do have these traditional plans, I think, are finding that just the costs are unattainable. And so it really is a triple win in that they could reduce their costs, provide choice, and provide empowerment to their employees and solve some of their financial challenges all at the same time.
Meghan, you just brought up the challenges that higher ed faces. In addition to that, what would you say are the biggest challenges colleges and universities face when trying to make major changes to retiree healthcare benefits?
Yeah, I think there's several. First and foremost, unlike what we see in general industry, where there's been kind of a trend towards moving away from offering these sorts of programs, higher ed and many schools still have very robust healthcare options for their retirees. And so they're very highly understood and valued by the employees. And any change, frankly, I think can feel a little bit like a takeaway. And even if it is a win, I think that people in higher ed, just from a culture standpoint, are going to question and want to understand what is changing and be a little bit skeptical. And so it sounds like a little bit of a dig on higher ed, but it's actually the reason I love working with colleges and universities. But the culture of kind of always questioning and challenging and really wanting to dig deep is a little bit of a barrier in terms of making a big change like this. There is this culture of, having a lot of voices at the table when any sort of change is made. And so there, whether it be faculty groups or other staff organizations kind of having a say in different sorts of programs. And so that slows down, I think, the wheels of change a little bit, and is very healthy and good. It creates good dialogue, but makes a big change like this a little challenging to implement.
Yeah, that makes a lot of sense. And Margaret, for you, what kinds of communication mistakes do schools often make when changing retiree healthcare plans?
This isn't just limited to schools, but I think a lot of organizations often underestimate just how deeply personal and emotional retiree healthcare is. In higher ed specifically, faculty and staff expect transparency, messaging that's backed by research, and alignment with their institutional values. So when communications feel too transactional or lack empathy, I think it can lead to skepticism. So that's something that we really try to work with clients on is ensuring that their communications really are focused on more that emotional component. I think another thing that we like to promote is not just relying on print materials, really ensuring that there's in-person support, personalized support for retirees. Retirees like to talk to people. They like to be able to hear themselves think. And so helping them with that personal interaction can really be helpful, and ensuring that they understand not just what's changing, but why. And hearing that from someone that they trust is something that we like to focus on to avoid those types of communication mistakes.
I would add one element, and I don't know, it's a mistake that we see often. Maybe this is a plug for Margaret and what Margaret does with our clients, and that is taking stock of all the different audiences and groups that are invested in a change like this before moving forward. I think Meghan talked about sort of this broad decision making, but also once a decision is made to make a change, bringing those different groups to the table and understanding their concerns, thoughts, audiences, et cetera, and not missing any, because if you miss them, and I think Margaret does a great job of not missing them, if you miss them, then you end up with major sort of misunderstandings down the road.
Yeah, great point.
Yeah, and you mentioned communication change, Margaret, and building trust. How can they build that trust instead of creating resistance among their community?
Yeah, I think it really, back to the empathy, I think it really does start with that. It starts with clarity and empathy, and really having the ability to explain the rationale that connects with their missions and values. We talked a lot early on about cost savings and that being one of the rationale for universities making this change, but that's usually just part of the equation. It's a lot about that personal choice and flexibility. And so helping empower retirees to understand what their particular needs are and then matching that to what's available in the individual marketplace has been really, really, I think, compelling, and helps them to have that trust that you were talking about. So I think that's a big part of it. Eric, you also mentioned finding those groups of trusted individuals, and finding people who can be champions for change can be really, really impactful. So universities in particular often have big retiree groups, they have alumni organizations, they like to talk to each other. And so identifying early on an individual or groups of individuals who can be brought into the change early on, whether it's through focus group or individual conversations, and getting their feedback and helping them understand why the change is happening and what's in it for them, they can really ultimately be a big support in the overall transition to build that trust and avoid some resistance that change often brings about.
I think you said a key thing of the early on aspect. One of the challenges, I think, with higher ed is making sure that you're getting the right stakeholders at the right time as well. And so I think one of the big lessons learned is, and making this a successful transition, is that the right people are giving their voice and having a say in kind of how this is rolled out.
This is a two-part question, Meghan, maybe to you, Margaret, as well. You're talking about getting the right people involved early on in the process. Who are those right people would be one of my questions. And then the second part of that question is, how early in the process are we getting everybody engaged, and where do they fall in? I would imagine leadership very, very early in, but where do the affected individuals who will ultimately be a part of this transition, do they get brought in prior to the decision for input or only after the fact?
I think it's going to differ for each organization, but in my experience, a lot of schools, might have faculty that are studying health policy or are kind of experts in this area. And so I think in those situations, bringing individuals like that kind of, they have research, they have data that could help support a transition is really key, and helping make sure that they're comfortable and can be an advocate if they are kind of in agreement with change, or voice concerns if they have ideas that are maybe contrary to the change. I think too, making sure that from an organization standpoint, the right type of leadership. So often, in our world, we're working with HR who's doing the design, but making sure that finance is on board as well, and understanding some of the cash and financial modeling implications are done as well early. And so I think it's again, that early on, making sure that people who have a voice ultimately are being able to voice either their concerns or their support, and be able to kind of advocate for the change.
Yeah, and I think when we get into the actual communication development, getting people, when we say early, having a select group of individuals who can play that support role, reviewing some of the communications and reading through the messaging to make sure that the tone is striking the right chord, and the way things are being explained are clear and easy to understand. And so getting that part of the change management process early enough to influence the actual announcement and transition communications has been really helpful for us to see a more successful and smooth transition. Nina, you were also asking about when do actual retirees and individuals need to be informed of a change and how much advance notice. What we have found is that making sure people have enough time to really understand what's changing, do some research, especially in universities, giving that ample time to read through, to ask questions, to ensure that they feel confident, but not too early. So, you don't want to give people too much advance notice, because then they can just start spinning without actually being able to take any action. So there's a fine line between early and too early. And that's something that we would certainly, we work with clients on all the time, making sure that we're doing that transition timing appropriately for the particular groups that are involved.
So it seems like timing and communications are some key ingredients to success here. Eric, what would a successful transition, or what does a typical transition to the individual marketplace look like for a college or university?
I'd say every transition that I've been involved with has had some unique attributes to it. And I think that's because the historical benefits have grown up differently with different institutions. And whether it's eligibility rules or subsidy design or committee decision structure, right? Each one of the transitions may potentially take a lot of different directions. And that's good. I think Margaret made the point. It's personal and it's unique, and I think that's something that's important to do. Generally speaking, right? There ultimately is a conversion of, in most cases, an employer subsidy, which historically has only gone to subsidize health plan premiums, to a structure of a health reimbursement arrangement, which is a more flexible reimbursement account for retirees. That conversion is typically done in a way that is a win-win. I think Meghan said it. It's a win for the organization in terms of some cost savings, maybe some volatility reduction, and it's also a win for retirees because they're getting more value on the individual plans than they were getting in their group plans. I think there's that component, and that's a really important part to explain to people because it does take some getting used to. And then ultimately there's a period of time where there's education, pre-enrollment, plan comparison, and ultimately enrollment in new plans. And that's something that typically takes 2 to 4 months. And ultimately, it's moving the retirees from a group plan environment to their own individual plans, making sure they understand those plans, are confident in their decisions, and get their new ID cards and are off and running. And that's a process that, the end state looks very similar for organizations. I think it's just getting to the end state that may be a little bit unique for each.
Based on what you're seeing, Eric and Meghan, Margaret, feel free to chime in, but based on what you're seeing, how do you see retiree benefits changing in higher ed over the next few years?
I'll give a comment, but Meghan, I think you maybe have the most to talk about there. What I'm seeing, and most recently, is I think higher ed has begun adopting more modern approaches to benefit structure. And when I say more modern, I think injecting some consumerism. I think Meghan, you may have said that earlier. But in addition to the retiree health exchange model, I think more of that consumerism is also going toward active employee health benefits.
I think that there's been a little bit of a shift in higher ed, in part because of the environment right now, but also just in general of more emphasis on kind of employee choice and employee empowerment. I think historically, universities and colleges have been pretty paternalistic and kind of we're offering the plan because we know we're protecting retirees, where it hasn't maybe met the needs of their entire workforce. And so I think we're seeing this trend towards giving employees more kind of control over their benefits and ability to kind of spend their dollars in a way that's going to be most impactful for them.
And then my final question, I'll pose it to each of you. Eric, I'll start with you. What is one piece of advice you'd give to an institution that's just starting to explore this option?
I think Margaret said this, but I think transparency is really important in these kind of evaluations, and starting with some clear goals, right, which are transparent. And when I say transparency, I mean it's okay for an organization to manage its healthcare spend, right? I mean, I don't think that's not a goal that should be hidden from retirees or from employees. It's something that helps the sustainability of those benefits. But at the same time, all of these organizations have commitments that they've made to their employees and retirees that they are doing their best to maintain. And I think that's something, and that transparency, I would start there. I probably could think of about 10 other things, but you made me go first. So I'll hand up the mic.
Margaret, I'll go to you next. Same
Sure.
question.
Yeah. I would say, don't shortchange the change management piece of it. Allow enough time to really think about who are all your stakeholders, both internal and external stakeholders, and give enough time to ensure that you're bringing people on board in a way that is going to make them feel confident and comfortable. One of the things I meant to mention earlier, and I'll bring it up now, is especially in universities, we see that the in-person meetings are so important. It not only gives retirees and their family members an opportunity to learn more about the change and give them the information they need to take action, but it's a really nice time for them to socialize, to see old peers, and it's been a way to really improve the implementation and transition. So making sure that you're allowing enough time to plan effectively and appropriately for that maximum success in the transition is what I would say, just to make sure that that is being considered when you're planning a rollout of something like this.
Meghan?
They both said it so well. I don't know that I have much more to add, but I think just an awareness that you probably are going to get pushback and some skepticism, and being prepared on how to address that so it doesn't kind of taint a lot of the good messaging that needs to be there, and how to address with research and information that's data driven.
I thought of one
Yeah.
other thing as you were talking, Megan. I think Nina, you asked the question, what does a transition to this model look like for higher ed? And I said, well, they're all sort of unique. I think one of the things that all organizations, higher ed and others, the more that they can simplify the benefit so that people can understand it, their eligibility rules, their subsidy rules, their all of those different elements to their benefit design, the better. Because I think these things have grown up and the complexity sort of piles on itself. And this is a chance to simplify. And I would encourage them to take advantage of it.
Yeah, that's one thing I hear a lot, is that retiree benefits are complicated and confusing. So anything that can be done to help simplify for retirees is great. Well, thank you, all of you, for being here today. If you are a higher ed institution or any other plan sponsor who is looking for more information, visit viabenefits.com and select plan sponsors for more. Thank you.
You've been listening to the Via Benefits Exchange. For more information about Via Benefits and the solutions we provide, visit viabenefits.com. That's VIA benefits.com.